Hello, everyone. This is Kim Schatzel, and it's good to be able to have a chance to visit with you all virtually today for another town hall. I want to begin by introducing the folks that are with me on the panel. We have Melanie Perot, who's the Provost and Executive Vice President for Academic Affairs, Ben Lowenthal, who is the Vice President of Admin and Finance and also our Chief Fiscal Officer, and Vernon Hurt, who's our Vice President of Student Affairs. We're going to spend as much time as possible to be able to answer questions. So I want to make sure that I get to those very, very quickly. But I do want to take a few moments and just thank the co-chairs of the Return to TU Task Force. And that would be Vernon, as well as Melanie and Sarah Slaff and Steve Jones for all the work that they've been doing, as well as the dozens and dozens of individuals from across the campus who are working on the implementation teams, and the hundreds of people that are also working in subcommittees and doing their jobs to prepare the campus for the return of classes and to people coming back in the fall. I can share with you the fact that last night I went out to dinner with my husband, and the person who was the wait person for us was a student from Towson University by the name of Marty. She is a music education student, and she's a rising senior. And when she started talking to me and she introduced herself, one of the things that she talked to me about was how excited she was to be coming back to campus, how much her friends meant to her to be coming back to campus, how much she was looking forward to the faculty. We also commiserated on the fact that the last event we saw was Prism, that she was in that, but that we didn't do Pirates of Penzance last year, that we didn't have the dance recitals that we typically have. And with her being a rising senior, she was really, really, really hoping that she would be able to experience those type of important milestones in her senior year. She also talked about the fact that she was observing in the fall as a music education major and was going to be doing her student teaching in the spring. You know, spending that time with her, I really said that I realized how much I miss our students, and I know we all do, and how much our students miss us. So with everybody working together to come back to campus to provide for that experience, I just want to say thank you to everyone. It's going to be a different campus. It's going to be a campus where we're going to use physical distancing. We're going to have lower density. We're going to have masks. But that face-to-face experience that our students have with our faculty and our staff, that means so much as a high-impact practice, where they do have the opportunity to have mentorship in small classes and personal attention. Well, it's one of the reasons that we have one of the highest student success rates of universities in the nation. It just means so much. 85% of our students come from Maryland, and of those, 100% of them are either going to be, that's all 23,000, are either going to be living in a residence hall, commuting from home, or they're going to be in an apartment on campus. They are looking forward to returning. And as I said, it's going to be a different campus for us, but we're going to work together to make sure that it's an experience for them that means so much. 24% of our students are Pell Grant eligible, and about 28% are first generation. So this means a lot to them. And often those students are ones that are most vulnerable. So the support that we can give them when they're on campus and when they're in the classrooms, even though it might be different in terms of the fact that it'll be a hybrid where half of the class might be coming every third day and the rest will be done with streaming, it's still going to make an impact on their success. So I just want to tell you the fact that I enjoyed talking to Marty last week and last night, and I know that all of us are working together to make sure that we can reinvent this campus for a hybrid for our students to be successful. And I just really look forward, and I want to thank you, everyone, for all the work that they're doing. With that, I appreciate you indulging me to be able to talk about Marty and to be able to share that. But if we can go on to questions. Marina Cooper, I think you'll be handling the questions, Vice President of University Marketing and Communications, isn't that right?
That's right. Thank you, President Schatzel. And we have our first few questions already in. Folks can use the Q&A button. If you scroll down to the bottom of your screen, that should pop up for you at the bottom. First question is, will students who are coming from hotspots be quarantined upon their arrival on campus?
So I'll take that one. The governor, one of the things that we're going to, of course, is to be able to take a look at what the governor's directives are. As many of you have read, Connecticut, New York, and New Jersey just basically provided for that type of quarantine. There is no such quarantine that we're looking at in terms of Maryland, in terms of the governor itself. So at this time, in terms of being to work with the governor's directives as well as CDC, we're not going to be requiring that. But as we've said from the beginning, things could change. It's also the fact that in many of those states that they've tightened up. Instead of moving to opening quickly, they've actually retrenched. But I can the fact that we will be closely monitoring it, as well as the USM is closely monitoring it. We're in constant contact with the governor's office and the legislature with regard to making sure we're compliant with the latest health practices and public safety practices.
Thank you. Next question will be directed at Vice President Hurt. Will campus recreation be opening this fall?
Sure. Thank you, Marina. So the plan is that campus recreation will be open. We anticipate that we will have different functions. We'll have social distancing in place. We'll certainly have limited activities based on what our state and CDC guidance is, but we certainly are committed to having as optimal of campus life as possible. So campus recreation will be open.
Excellent, thank you. Next question is, I think this one might be directed to the president, and you can defer, of course. It is difficult for me to breathe with a mask. May I wear a face shield instead?
We recently put out I think it was yesterday, that the task team leaders, the Return to TU Task Force co-chairs, put out a message, and coming next week is going to be a mask policy that really is very specific and detailed about what kind of masks, when they would be used. One of the issues is, of course, in the fact that if you have some type of breathing difficulty, that we need to be able to make accommodations for that. So I would suggest the fact that when that policy comes out next week, that you take a good read to it. If there's questions, of course, we'll be able to clarify any of those, but we're taking those kinds of situations into consideration as we're developing the policies.
That's great. We have a follow-up to that question, and it's from Coach Diane Richardson. Will everyone be required to wear a mask?
So yes, but there are exceptions in terms of strenuous exercise, physical distancing outside. Again, I don't have the policy in front of me, but I can tell you that we are going to be a masked campus, most specifically in terms of the buildings themselves and areas around campus where you cannot socially distance. They're going to be required, and we're specific about what they look like. When we're dealing with strenuous exercise or when we're dealing with athletic exercise, there are exceptions that we're going to be looking at, because I think that's probably where Coach Richardson might be interested in having an answer to. But we've worked in conjunction with athletics as well to be able to take those into consideration. So again, the policy, I believe, is coming out next week. And I believe, based on the questions you're asking, and I've read it, it's very, very complete. But we look forward to having additional questions about it, or if there's gaps that need to be closed in terms of the policy itself, so there's a full understanding.
Here's one for Vice President Lowenthal. Will there be changes in the parking charges due to staff not being on campus full-time in the fall semester?
Thank you, Marina, for that question. And the answer is yes. In fact, what we will be doing is charging for parking, first of all, only on a semesterly basis, so that we can continue to monitor. And the good news is that that semesterly cost will be at 50% of the normal semester parking rate. And that's true for just about all students and faculty and staff. Resident students who will be parking on campus 24/7 will have a 20% discount. So for the most part, everybody will have a 50% discount on parking. And that is if you opt in to take that parking. Of course, if you're not coming on campus very frequently and you choose not to buy a pass, a semesterly pass, you'll still have available the ability to buy the daily passes.
Excellent, thank you.
Ben, do you want to just add the change in terms of the resident students going to West Village Commons to free up more space?
Yes, thank you, President Schatzel. So in addition, we're going to free up lot 26, which is the lot that's right next to the Glenn Towers, by moving students or resident students to West Village. So that will allow for more spots in the core of campus, because we anticipate that There'll be more demand, certainly at key times, middle of the day, where there's more students commuting. At the same time, that should be offset by the fact that there will be fewer people parking on campus due to the teleworking arrangements and fewer resident students overall. So that lot will become available. It's 150 or so spots that will be added. And then parking transportation will continue to monitor throughout when we see that there's opportunity to possibly allow for even more spaces, with ensuring that no one loses their space. We will make changes as we go along into the semester.
Thanks, Ben.
Thank you.
Thank you. Next question is from Bethany Willis-Hep. She asks, is there a plan for what faculty and students will be expected to do if and when a student or faculty might have a confirmed case of COVID-19? For example, in that hypothetical situation, will we be requiring self-quarantine?
So Vernon, you want to take that? Yeah.
Yeah, I will speak to the student part of it. So we will have a process in place for both faculty, staff, and students to be able to report to the campus COVID-19 positive cases, or having any contact with someone who has been COVID-19 positive. In the case of students who may be symptomatic or COVID-19 positive, we are holding one of our towers as isolation space for students to be able to self-isolate. And so those students who are residential will have that space to be able to self-isolate for the required period of time.
So, and just to chime in here, we're also partnering with Baltimore County for the contact tracing protocols. So all of that would fall into place in accordance with the CDC guidance and Baltimore County's policies. And so the contact tracing would begin immediately. And so people would be notified and told what's recommended at that time.
Thank you. Thank you both. This next question is really about large scale events. And so I'm going, and it's about whether or not there will be large scale events of 50 or plus. Also asking about if we've made any plans surrounding homecoming for fall 2020 term yet.
So I'll talk about the events. You know, a lot of this is going to be determined by what our state guidance is at that point. At this sector, we are not planning to host any events for off-campus sponsors. In terms of campus events, we will have opportunity for some campus events. I anticipate we will not have large-scale events, many large-scale events, but we will have, you know, the state's guidance to help make those determinations. We do have a subgroup within the Return to TU task force that's actually looking at our policies, both from a facility capacity standpoint and also our policies around programming. No decisions have been made at this point regarding major events like homecoming or family weekend, but we do have some meetings upcoming to make some decisions. And so I anticipate we'll have decisions in the coming weeks.
Thank you. Next couple questions really are around screening and symptom screening on campus. Will students and faculty members, as well as staff members, will their temperatures be checked as they entered the building each day? I'm gonna give that one to President Schatzel. I think you have some background on that, but others can also chime in as well.
Thank you, Marina. So one of the things that I first want to be able to provide is the fact that we're working with the other USM institutions. One of the big benefits that we've had of being part of the University System of Maryland is the fact that there's other campuses, and one of them is actually UMB, and it's an academic, it's a medical school, and it's also an academic hospital that has some of the, many of the professors that are there are on Governor Hogan's task force. So they're, nationally known virologists, nationally known epidemiologists, infectious disease people. So one of the things that I just want to make sure of is the fact that we are getting tremendous expertise and tremendous support from the USM and from the medical school and from the University Medical Center to be able to come up with the regimens that we're using. The experts are recommending right now that there is symptom checking. So what we will provide is the fact that everybody's going to get a care kit. All faculty, staff, and students are going to be getting a care kit in, I believe, the latter part of July or early August. And one of the items in there is going to be a digital thermometer. And with that digital thermometer, we're asking people to be able to do a symptom check every single morning. And in the symptom check tool that's going to be used, it will ask for temperature, it'll ask for various symptoms, I think 3 or 4 questions. And depending on the responses to that, you'll be advised to be able to contact actually a telemedicine group that is going to be stood up by the University of Maryland, Baltimore, to be able to provide for guidance in terms of what you should do next. Whether you should go to an emergency room, which is usually not the case, whether you should self-quarantine, who you should contact on campus. So we'll have all those procedures to be able to be set out to provide guidance both for the faculty, staff, and students. As Vernon said, with the students, if there's any issues in terms of symptom, that they will be quarantined, and we'll be communicating with faculty and staff as well. And we have a responsibility to report. So if somebody is tested and they're positive COVID-19, they need to report to us, and we need to be able to report to Maryland Public Health and Baltimore County Public Health to be able to do the contract tracing.
Thank you. Also a question from Kate Collins around testing as well. The testing on campus that's available to faculty and staff during this pilot, and particularly the plans that the university is making perhaps going forward, will this include antibody testing, or is it only for COVID-19?
So as it sits right now, and I'll answer a bit and then I'll give it over to Vernon. Right now, we're part of a pilot test that we're actually working with UMBC College Park as well as with UMB. And what we're doing is we've stood up, if any of you have driven past campus, there's a big white tent out in front of the health center. And we're providing testing to groups that have been considered higher risk, which is some of the ABM folks that are coming back, the dining folks, athletics, the students, both faculty and staff, as well as the research faculty that are returning to campus. So it's the first people coming back that we're bringing in to be able to do the testing. What we're planning on doing is to continuing that and making that available to the rest of campus so that we would be able to keep that stood up, have it open for 2 or 3 days. This is all by appointment so that people can get the COVID test. If the demand exceeds capacity, we'll have referral. For example, at the Timonium Fairgrounds, they're providing as well. So we'll be able to provide referral. But at this time, it is solely based on the test for COVID-19, not the antibody test. So it's a serology test, I believe, what it is. I've probably learned more medical terms in the last 6 months than in my entire life, but I think it's the serology test. But it's an important part of what we want to do. And again, we're participating across the system in terms of being able to make sure that we're using similar protocols to be able to do that. And it's going to be manned by MedStar Nursing. We're going to hire nurses to be able to come in just because we don't have the bandwidth to be able to have the university, our own health center, and to be able to have it staffed appropriately to be able to do. Vernon, do you want to add some more to what I've already said?
No, I think you've covered it well.
All right. Excellent. Well, there's plenty more questions. We got about 52 open questions, so I'm going to keep pushing through some of these. We've got the question of, will all faculty, staff, and students need to complete that daily survey that the president mentioned, even if they aren't coming to campus on a particular day due to remote teaching and learning? I think we can answer that question.
I really don't know, in all honesty, of whether it's if you're coming. My understanding, and again, I don't want to jump ahead of myself in terms of doing it, but so people correct me, and we'll have this all laid out by the time we start phasing back in. My understanding is the fact that you do need to take it each day, that it's not just when you're coming to campus. And I'm looking at my colleagues to see if I'm right.
Yeah. So the part of the goal is to be able to understand trend lines. And so, we would like people to do it every single day, even if you're not coming to campus, because that will help understand if we see, an increase or a spike of people saying something's not right. So the aggregated data will go to, there's a faculty panel that's been established that will review the daily results just to see if there's a trend that's happening. They will not see any disaggregated data, nobody will. And that data will be wiped every 14 days. So, and when you see it, as the president says, it's three questions. It's, I would say, very non-intrusive, but it'll help us to get some idea. Do we see a spike? Do we see something happening here? Really kind of an early warning system. So the more that people do it, the better.
Thank you. Next question is, what technology, we can keep this with the provost, what technology does TU have available for faculty and students to implement live online classrooms such as video? This particularly concerns this individual, Kevin, because the class that he teaches includes a lab portion.
Great. So we are busily building out. So there already were many classrooms that had that capability, but OTS is spending the summer putting in additional capacity, so to the tune of $500,000. So they're putting different systems in different rooms, and in other places where it doesn't make sense to have a fixed camera, they've purchased a bunch of mobile units. And so we're confident that every classroom will have the ability to be visually recorded or visually broadcast, simulcast. So every classroom's going to have it. So we're feeling confident about that.
Excellent, thank you. Next question is kind of two parts, we'll start with the president on this one, and there might be others that chime in. When will faculty and staff be coming back to campus? And will faculty and staff go to full remote work post-Thanksgiving?
So we're going to phase the campus reopening. So actually, we've just sent out a staff survey to be able to determine that. And I know the provost is sending out a second faculty survey to be able to take a look at how we can phase people coming in. So it'll be a phased reopening. So you should be getting information about that over the next 2, 3, or 4 weeks in terms of being able to return to campus itself. And the provost, I think, can answer the question about after Thanksgiving.
Sure. So, so our research faculty, by the way, are starting this week. So that's part of it. That's the first phase coming in. But yes, so the plan is that after Thanksgiving, all courses will go to remote delivery. So there will be no face-to-face on campus at all post-Thanksgiving. So it's about a 3-week period.
Thank you. Follow-up question from Jeremy Farkas. Without knowing yet what the Maryland Department of Education, and in his case, Baltimore County Public Schools are planning for K through 12 returning to school, will TU support faculty, staff, parents of K through 12 teleworking half days, or even possibly 1 to 3 days a week should there be a gradual return or full move to online learning for some of those lower grade levels in K through 12?
Right. That's a really interesting question because we're about 60 days out from public schools being opened. It's hard to be able to speculate what that would look like and what that would mean. When it comes, we're asking people to be able to report what they can do because of the fact that we have to be able to provide support for the students and the faculty to be able to open up as needed. It will cause us to have to take a pause to be able to understand what that impact would have on the campus itself. And it's not just our campus, it will be across the state in terms of both businesses as well as government operations. So we'll have to take a look at that and monitor it as time goes on.
Thank you. Next question, Stephen Eisberg from, and this one's for the provost. Will there be a university-wide standard for faculty to follow in moving face-to-face courses to synchronous online delivery? An example is, if a class is scheduled to meet Tuesday, Thursday at 11 a.m., will the faculty be asked to deliver live streamed class sessions at those times?
So what we're asking, we're keeping the times will stay in the schedule for any synchronous delivered classes, because it's really important that faculty stick to that time so that they don't intrude upon other classes. So those times will stay. So any activity, any synchronous activity has to fall within the confines of that class. And so what I've asked faculty to do is, even if your plan is to be off campus the whole semester, if you could have at least one synchronous activity a week, what that synchronous activity is can differ, of course, by class and by faculty member. But our students crave that live interaction with faculty members, and that was very clear after the spring. And so having that contact, having that ability to ask questions, to have discussions, that's really important for our students. And so that's why we're asking, look, whatever synchronous means to you, how it fits to your class, we'd really like you to do your best to do that.
Thank you. Provost, while I have you, are nursing students going to be able to do clinicals in hospitals for the fall term? Do we know anything about experiential learning or clinical experiences?
So, I know that's a real challenge right now, and, we're highly hopeful that they can. There are some students right now that are doing clinicals this summer. As you might imagine, some of the hospitals, their priorities shifted very quickly during the pandemic, where being able to do that intensive work with the student was set aside because their focus really had to be on treating patients, and some very sick patients. And so we're hopeful that'll come up. So Dr. Dean Plowfield is working with a whole return to research team, and part of their job is looking at how to safely return to clinicals. And so they have all sorts of protocols put together. And so for each clinical, for each internship, for each field experience, we'll be asking a set of questions so that people say, here's what the standards are, how are you meeting them safely? And then that clinical or that experience can be approved. But so a lot will really rest on our partners in healthcare, but I know they're all working very hard to be able to have enough of those for our students.
Thank you. Next question is around budget. We received a budget message last Friday. Vice President Lowenthal, how is Towson University doing in terms of its financial standing? And are there any budget questions, or budget updates that you can provide for us at this time?
So the message we sent last Friday is really stands right now. No additional updates to add to that. I just want to repeat that we've been working very hard to combine all the tools that we have available, including the fact that we have a hiring freeze. We're cutting back in a big way on purchasing. We did get a significant amount of CARES federal dollars, and all these tools put together is what enables us to continue to say that we do not anticipate any actions in terms of employee actions, meaning layoffs or furloughs, and that will continue to just be a very last resort as we move forward. So we are hopeful that will stay that way, and we're appreciative of the cooperation that we need from everyone to cut back on the spending in order to enable us to continue to move forward with that and really protect our people, which is the most important asset that we have.
If I can add, it's been a priority of mine, and it's been a priority of the senior leadership team and the president's cabinet, that we're going to make sure that the first priority is our faculty and staff. And that's meant the fact that, as I described it, we have to find 2 more holes in our belt as we pull it tighter and tighter. And the fact that, we started out with a hiring pause, and now we're at a hiring Arctic freeze. And the reason is because of the fact that everything we do to be able to avoid costs right now, and the fact that we can continue with our efforts to be able to protect our faculty and staff, and make sure that we can keep them whole and keep their livelihood. I also feel the fact that it's really tough to hire people into new positions when we're doing it this way, and it really puts a big burden on them. So all in all, it just makes sense from that standpoint, as well as from the fact that we want to make sure that we keep our faculty and staff our priority. I know that's causing a lot of people to rethink priorities and to find different ways of doing with less. And that's what we are asking people to do. But it really means a lot. And I just want to say I'm very grateful for everybody working together to have that happen.
Thank you. The next question is really around students and trying to balance and figure out their schedules for next year. When will students know whether or not their classes that they will be taking will be online or in person? And will they be able to dictate their preferences? And how do they ensure that an online class might not be happening at the same time as an in-person class?
So I'll take that one. We are doing a second faculty survey next week to understand what the faculty intent is. So after having some time to think about it and to see some of the preparations we've done on campus, what is the faculty choice? Our expectation is by mid-July, we will put into the class schedule. Every single class will have a note on it that indicates what the mode of delivery is going to be. So there's essentially asynchronous online, so that means anytime. Synchronous online, so that has the time connected to it, and then a face-to-face, which will also have sort of that hybrid element that it will be recorded in some fashion so that it can be simulcast out to anybody a student who can't come into campus. So those are the different options that will be out there. Each of them will be noted in the course schedule, again, by mid-July is our expectation. And so normally when a course goes online, you remove the time slot and you remove everything from it. But because we're asking for this synchronous element, we are leaving the time slots in. And so that's how we're trying to reinforce this idea. Please don't tumble into somebody else's course. So that will be the expectation, that all of our courses stay within the confines of the assigned time and that they don't bump up against some other course.
Thank you. What special considerations are being considered, taken, and proposed for live-in staff with housing and residence life? This is a question for Vice President Hurt, particularly those that might be exposed to students 24/7 once they return to campus.
Sure. That's one of the things that we're taking a look at, to the point that the president made earlier in terms of some of our staff who are more high risk. That's certainly a group. And so working with our assistant vice president for housing residence life, Kelly Hoover, to look at how we might make staffing arrangements to have everything from appropriate PPE to even different ways of working, to be able to have appropriate protections in place to support for those staff who are more in those high risk categories.
Thank you. Next question, I think this one's for the provost. Will the Child Care Center be open, at least for faculty, staff, and students? And if so, what is the plan for keeping a lower capacity at the Towson Child Care Center?
So it will be open. They're working on the plan right now. And so I'm expecting a final proposal shortly, within a week or two. So of course, there's all sorts of regulations and guidance specific to child care centers. And so our child care center will follow all of the requirements that are out there, but our intent is to open it.
Thank you. This is a question, I think, for the president. What would trigger, short of the governor issuing a statewide shelter-in-place, what types of indicators would trigger the campus to move to a online or remote format again?
The only thing I can think of would be either that there was a statewide or a local decision to do that. So it either come from the governor's office, but there's also the provision of the fact that the Baltimore County chief executive can also do that. So the governor sets a minimum bar, I guess is the best way to be able to say that. but all the counties can be able to make changes that way. But we would be guided by state and local directives. We would not be making those kind of decisions by ourselves.
Thank you. There's another question here around cleaning and who will be in charge of cleaning. How will that happen between classes, in the 10 minutes between classes that begins? And what about classrooms with fabric seats?
So maybe you want me to tackle the classroom question, and then maybe one of y'all can tackle the larger. So if you've come into the academic buildings, you're going to see everywhere giant buckets of those wipes that if you've gone to the grocery store, it's a very similar situation. So there's hand sanitizer stations, and there's the wipes. So the expectation is that when you walk down the hall as a student, you grab the wipe and you hit your desk and hit your immediate area, and that's the treatment between classes. And then at the end, beginning and the end of the day, there's a larger cleaning. I'll turn that over to Ben to talk about.
Yeah, so we've been working with our vendor, ABM. They have increased the number of cleanings. They will continue to do that. They're concentrating primarily on the spots that are highest contact. So things like doorknobs, et cetera. They'll be cleaning those multiple times a day. And they'll be doing comprehensive cleanings at the end of each day. And of course, they're using all kinds of the sanitizing equipment that's CDC guidelines provide, so that it does kill any germs that might have been there. At the same time, I'll go back to what the provost said a moment ago, is that it would be pretty much impossible to do this every few minutes. So we certainly hope and appreciate that anyone that's coming onto campus will make use of those wipes. Those will be monitored constantly, and there's also a phone number on each one of those tables, so that if anyone notices that those are not in supply, call that number and we'll make sure to get the hand sanitizer and the wipes refilled. And clean around your own areas is the best way to ensure that there are no germs that are left behind.
Thank you. And then here's a follow-up question to that. And this might be more for the provost. Are classes going to be held in non-traditional spaces? For example, conference rooms, ballrooms, temporary outdoor locations?
Yes, so we are getting very creative with classrooms, and I appreciate the assistance of our events and conference services and everybody's working in facilities. So we will be using West Village Commons as classrooms. We're looking everywhere there's a space can become a classroom or an office. So we know that's another potential issue. People not necessarily want to meet with their students in a small office. So a seminar room could become a temporary office. So we are also getting creative. The College of Health Professions has requested a tent, a large-scale tent, to be put up outside to put essentially a simulation lab outside, because the idea of circulating students through in an outdoor environment they feel is a little safer, and they can get the physical distancing they're looking for. So everything's an option here. It's from tents to gym spaces to the conference spaces. We're prioritizing academic delivery as #1 use, and then cooperating with each other on how we might swap out for other uses. But there'll be all sorts of alternative spaces for the fall.
Great, thank you. A little bit more about those spaces. This one's for Vice President Lowenthal. What is being done to modify inside spaces for buildings on campus to protect faculty, staff, or students? Example, air purification, plexiglass barriers, signage, etc.
Thank you, Marina. So when you come back on campus, if that is the case, you'll see there's signage going up all over campus that very clearly indicates which doors are used for ingress, which are egress. The hallways have signage in terms of which direction folks should be walking in, making sure that one side or the other. We have many decals on the floor in areas that would be a waiting type area, so in front of elevators or restrooms, that are spaced 6 feet apart so everyone knows where to stand. There's also a an effort, and actually it's been completed already. Facilities has completed the effort to maximize the amount of air circulation in every building on campus. In many, many cases, it's at 100%. Some cases, it's slightly less, but that is, as the CDC has described, helps keep safety of everyone at a much higher level because we're constantly recycling the air with fresh air from the outdoors. And the shields, as far as the plexiglass shields, facilities is also working on that. They've installed those in places where social distancing is difficult, in particular places like the university store, where you might be doing a transaction at a counter, in dining facilities as well, working on installing all of those so that they'll be in place in time for the start of the semester later in August.
So I'll just chime in on the academic space and plexiglass. Facilities has also reached out to each of the deans and asked for their needs for plexiglass as well. So that conversation is happening right now.
Thank you. The next question is around, it's a follow-up on requirements. Will students and faculty be required to self-quarantine if they test positive? And along those same lines, are faculty, staff, and students required to be tested prior to returning to campus?
So I could take that. They will be required. If you're a student, residential student, you'll be required to quarantine as Vernon talked about. We have one of the residence halls to be able to do that. If you're a residential student, if you're off campus, we're going to ask you to quarantine in place to be able to do that. So that's going to be a requirement to do it. In terms of testing upon coming back to campus, I'll give this to the provost. The provost actually sits on the USM return to campus, return to class task force that spreads across the USM. And one of the areas that there's, as I've mentioned, there's a tremendous amount of collaboration on with the expertise is in the area of testing, monitoring, PPE. So provost?
Thank you. So the best scientific guidance at this time is that we should not do mass testing, that's not an effective way to monitor the spread of the illness. And so they've really emphasized that symptom monitoring is the way to go. And so that's why we've really worked towards that direction. But as we said, we are offering a one-time COVID test for all faculty, staff, and students should they choose to do it. Again, it's right on our campus, or if it gets too busy here, of course, there's alternate sites that have been set up throughout the county. So the best scientific guidance does not suggest that mass testing is the most effective way to monitor COVID. So we'll continue to follow science. If that changes and that advice shifts, we will shift with it.
Thank you. Next question's for Vice President Lowenthal. Will dining areas be open, and will there be restrictions for those purchasing meals and who want to dine in?
Thank you, Marina. Yes, dining areas for the most part be open. We have a dining plan that will support the needs of the campus. There will be a few changes. So there'll be one or two areas that are closed, that some were supposed to be closed anyway due to construction on campus. So Susquehanna, for example, will be closed as part of the union construction, but we now have Glen Dining that is opening for the fall. There'll be a new retail in Glen Dining that wasn't there prior due to the new construction. And for the most part, campus dining will be open with slight shifts in hours. So the hours used to go to 2 a.m. in some cases. We're going to stop that at 11 p.m. for the safety of our students and those who are on campus. But for the most part, dining will be serving the same sort of food. It'll be takeout. Though it'll be takeout, there will be an option for some internal inside dining, if you will, using the same guidelines that we have, but in the state guidelines, which is at a 50% capacity. So that will be an option for those who choose to do so. There are a couple locations where we have outdoor dining available as well, and we are currently looking into trying to expand that for those who would like to eat and prefer to be outside rather than inside. So that's the high-level dining plan.
Thank you. Next question is about, excuse me, This is around classes. What will classes look like for COFAC students? Obviously, there are a number of students within the COFAC area that have music classes and a number of different formatting classes, Provost. Tell me about the conversations that are happening with the Dean and COFAC.
Sure. So the great thing about the faculty of COFAC is almost by definition, they're creative. And so they've been working very, very hard to come up with solutions to, clearly there's a challenge. You cannot play the bassoon with a mask on. And so how do you safely do that? How do you safely run a choral class? And so they are best positioned to understand how to do that. And so not only are they talking within the ranks of COFAC, but of course, nationally, this is a challenge across the board. So, music associations are coming up with separate standards and ideas of how to build plexiglass, or can you just do a choral, a private lesson, but literally in a classroom 20 feet away. So we're going to defer to those standards that the specialists in those fields have established. But I'm hearing some really tremendous work that's going on in COFAC, and so I'm confident they are going to offer the high quality classroom experience that they always have. Like everyone else, it's going to be modified, but they're coming up with great ways to do it.
Thank you. One attendee is grateful that we're on Zoom today. And the follow-up question to that is for Vice President Lowenthal. When will faculty and staff have access to Zoom? And is this something new that the university is exploring?
Thank you, Marina. I'm happy to answer that question. OTS has been working very hard to make Zoom available to all faculty and staff, and we anticipate that by the end of next week, it will be made available to all faculty and staff university-wide, and we will send further instruction and the specifics of how to access that, again, sometime towards the end of next week.
I just want to offer, my thanks to Jeff, as well as to Ben and the entire OTS team for pivoting to be able to make Zoom available to us as quickly as they've done, because I know there's a high demand for it within the campus area. So thanks very much to the two of you and to the team.
You're very welcome, and I also want to express my thanks to Jeff and the OTS team. I will add that this is an additional tool in the toolbox. So nothing else is going away. We still have WebEx, we have Collaborate in Blackboard, and we have Panapto. So this is just one more tool that we're adding to the toolbox for all of our Towson University faculty and staff.
Thank you. And the next question really talks about, excuse me one second. Next question is about mask enforcement. What should a faculty or staff member do in terms of a guest or a student or any member showing up without a mask? How will that be enforced, and will additional masks be provided?
So I can take that. So we will be a mask campus. The policies will have that. We'll have signage that provides for the fact that upon entry of the building, you have to have a mask on. If someone enters the building and does not have a mask on, of course, we're going to say you need to be able to have a mask. We will have masks available for those individuals that might have forgotten it or that they're a visitor to be able to do that. If somebody is non-compliant, then the first thing that we do is it's kind of like somebody walks into a building and they're smoking. We tell you the fact that you can't smoke on the campus, or if they don't have shoes on. Now, this is a safety issue, so it's even more critical. But we would tell them the fact that you can't enter the building. If it became disruptive, and we hope that it wouldn't come to this because of the fact that wearing masks is commonplace within Maryland. I mean, there's a fair degree of compliance, and on the campus there'll be such compliance that it'll become normative behavior. But if it becomes disruptive and someone is not compliant, then there'll be disciplinary action associated with in terms of the conduct code, as well as in terms of the university disciplinary action both for employees and that, but also if it becomes highly disruptive, TUPD can be called to be able to manage it as well. I'm hopeful, given the circumstances, and it's all about safety, that won't happen. But we are going to take the masking very, very seriously, and make sure the fact that everybody is aware of and is compliant.
Thank you. Next set of questions are really for Vice President Hurt. There's a series of questions about housing here. In general, what will housing look like for students on campus? There's also a question around our quarantine limitations or capabilities for students, and when will students know? That's the next question. When will they know that they are going to get campus housing this year?
Right. Well, I'll start with the last question. They will know this week, actually. So the Housing Residence Life team is in the process of making those final housing assignments and communicating that to students, so they will know pretty quickly. I will add that, again, health and safety has been the core of our planning. And so we will have a lower density model. So we'll have about 30% less of our beds on campus. We are working with a new development off campus and going into a master lease that will allow us to have about 300 more beds for students. So in addition to the adjustments that we're making on our campus housing, we're looking at other partnerships to expand housing opportunities for our students. So it will be a shift. Kind of guiding, following some of the best practices nationally that we're seeing in the field. The standard will really be around shared restrooms. So we will not be using communal restrooms. We will have no more than 2 students sharing a bathroom in our facilities. And so that really is the standard. In most cases, that'll mean students having essentially a single room. We'll have a limited number of double capacity rooms in some of our larger apartment style facilities. But again, the standard being no more than 2 students sharing a restroom. In terms of shared common spaces, there will be limitations in use. Just like other spaces across campus, we will have social distancing expectations, PPE use expectations within the residence halls, outside of the private room, of course. So you'll see that consistency across campus, including within the residential space.
Vernon, could you talk about the fact that Prettyman and Scarborough, because of the communal bathrooms, that we're taking them?
Right, they will be offline. I'll speak also. There was the question about capacity for quarantine. So we will have a space that will have well over 100 beds available for quarantine. So we're really fortunate that we intended to have one of our towers offline anyway, and able to use that space to have pretty optimal options for students to be able to self-quarantine.
Thank you. I know that you've made a lot of progress on trying to welcome as many students on campus as possible. Next question's for the provost. How are you prioritizing in-person instruction that goes hand in hand with kind of that residential student experience, particularly for our first-year students?
So I have asked the faculty and the deans and the chairs to all work together to prioritize having a face-to-face experience for our first-year students. So they're looking as hard as they can to make that happen for as many first-year classes as possible. So we know that if you're going to have the residential experience, you want the face-to-face classroom experience, of course. And so that is priority number 1 for the chairs and the deans, and that's how we'll work to schedule the rooms so that we can accommodate the first-year students and then sort of out from there.
Thank you. This is a follow-up to Vice President Hurt's question. Will there be an appeal process for student housing for those who would like to live on campus, particularly around the living learning communities and those programs and initiatives that really go hand in hand, the living and learning communities for student leaders as well as for residential students?
Yes, so there is a appeal process that's in place, and certainly HRL has communicated that process to those students that had active housing contracts. In terms of our priorities for housing, we really looked at those students who had medical accommodation needs that required on-campus housing, for those students who lived outside of 25-mile radius of campus, our students who had significant financial needs, and then students, their opportunity for students to be able to appeal that may not have fell in that space. The majority of our freshman students with contracts will be housed on campus, and we anticipate to be able to meet those needs, as we'll see shifts with students who may determine that they want to take all their classes online and remain at their personal residencies. We'll see shifts throughout the summer, and so we've decided to continue to provide housing contracts for students as they make plans and make adjustments throughout the summer. And so we're committed to really working with our students in a case-by-case basis to meet as much need as possible.
Thank you. Next question is about protocols, and I will give this one to Vice President Lowenthal. It is protocols for using the restrooms. Will there be multiple people in the restroom at one time? How will we provide for those capacity limitations in terms of physical distancing?
So I know that the Return to TU groups are working on specifics regarding the restrooms. That falls into the signage that I was talking about earlier, but I think I'll defer to the provost because she's on that committee and is more versed, if that's okay with you.
Sure. So there is, of course, specialized CDC guidance on public restrooms. So we are following that. And so the just the same as with the classroom capacity, elevator capacity, there are set capacities for restrooms. And so you'll see when you get to each restroom, there'll be a capacity sign. And I believe they're going to block off, indicate with signage, every other stall for those multiple stall areas. So that is a plan. We'll follow that specific guidance. And so, yeah, it'll be reduced capacity just like everywhere else.
Thank you. Next question is really around the checks and balances being put into place to ensure that some of our populations that are disproportionately impacted and marginalized members of the community, as well as those with disabilities and vulnerable, how are we making accommodations for those individuals? And I'll give that to the panel in terms of the different audiences that are represented on the panel.
Yeah. So as we've talked from the outset, anyone that is in a high risk group or has family members that would be in a high risk group that they have concerns about the exposure, we of course are going to accommodate those individuals. We also are looking at the fact that the density of the entire campus is going to come down just in general because we're looking at a lower density model. But anyone that is in those high risk groups or has family members that they would be concerned about should they develop the virus and bring it home, we're going to be working very, very closely with them to make sure that we have accommodations to be able to provide support for them. There's no question that we're going to be able to do that. That's what we've said from the very beginning, and we'll continue to be able to do that.
And
I would just add.
Sorry.
Yeah, I would just add from an academic and co-curricular standpoint, within the Return to TU task force, we have a work group that's specifically looking at various populations from a academic support standpoint in terms of whatever needs adjustments and how we deliver opportunities and programming for students, particularly thinking about our students with disabilities. Dr. Leah Cox is leading a group that is really looking at equity issues as we look at everything from policies to practices to ensure that our students are able and our faculty and staff colleagues are able to have the resources needed and be able to have quality experience that we want.
So, and I just want to give a quick shout out to the team over at Facet and to all the faculty who have signed up for training, which we're pushing towards 500 faculty at this point who have signed up for summer training. And so understanding how to design your class, whether it's hybrid or completely online, in a way that will help serve those students is part of that training. And so I'm really appreciative of that team, and I'm super appreciative of the faculty that are taking the time to do this work this summer. It's important work, and it's really going to make a huge difference in the fall.
Let's keep it with the provost. Can the mode of delivery be changed from one form to another during the course of the semester? Is that possible?
So we do expect that some people, due to the circumstances that evolve for anybody, will want to shift their modality. So so we do expect that there will be some people who shift from face-to-face to an online environment. That is possible and is not a very difficult thing to manage. It would be a difficult thing to manage if you indicated you were going to teach online and then suddenly you determined, no, I'd rather do face-to-face. So it's really unidirectional. So if you're face-to-face and want to shift to distance education, easy to manage and easy to communicate. The reverse is not true, simply because your students may be scattered all over the country and your classroom may have been given away. So we'll try to be as flexible as possible with everybody, but we do think largely it would work in one direction.
Just a quick time check. It is 5:01, and we promised everyone 1 hour. I want to be respectful of time. I'm going to ask just a couple more questions. The next one is about, and this is really for the panel, do we yet have an idea of how the spring semester or calendar might look? And is the plan to continue with possible high flex modality and as well as remote and online until we have a vaccine? So I'm just combining a couple questions here.
I think that for all of us, the first answer to that would be, it's so difficult for us to speculate that far in advance. I mean, I could just reflect on, if we just go back 60 days, how different it was. I mean, 3 months ago, we were on campus three months ago in 2 weeks. And look what's changed in terms of a whole closure and now a semi-reopening. So we really have to be able to stay flexible. We're going to start the fall because we have to make decisions, and we have to make the decisions based on the information that we have now. It could be that in 2 weeks from now or 2 months from now, there could be an opening that's different that we'd adjust to, or a closing that's different that we'd have to adjust to based on state and local guidelines. So I think flexibility is the most important thing that we can deal with when you have this level of uncertainty. And I appreciate everybody's patience around that. And I think everybody's gotten used to that just in terms of their everyday lives, and the fact that we have to be able to be flexible. So I just appreciate everybody's patience and support for each other. And as we know more, we'll let you know more. But we're always going to be guided by science, by public health requirements, by the CDC, and by state and local guidance.
Excellent, thank you. One more question is about students who are taking courses remotely. Will they be asked to pay fees? Well, yes, that's the question. Will they be asked to pay fees even if they will be taking online instruction?
So the mandatory fees are charged across the board to all students, and those fees, as well as the tuition, have all been held with the support of the University System Maryland Board of Regents at FY20 rates, with the obvious reason being that everyone's going through financial difficulty due to the pandemic. And so we felt it was the right thing to do and strongly supported that. That said, the tuition and the mandatory fees are being charged to all students across the board. There are some other fees that are not mandatory. Parking, for example. Obviously, if someone was not on campus at all, there's no need to purchase a parking pass. And that's where there'll be some differentiation.
Thank you. Next question is about contact tracing. How will contact tracing be handled for those of us who provide services in various spaces on campus that are frequently kind of moving around different spaces? For example, Office of Technology Services, facilities, etc.
So I'll just tackle that. So again, we're partnering with the Baltimore County on that, and they have people that are obviously highly trained and do this for a living. And so I know that we feel like, well, gee, we're mobile, and so that makes it more difficult. But so too would a post office worker, a grocery store worker, whatever. So they're trained to handle those sorts of mobility, people who are highly mobile. So we'll work with them, and we'll follow their lead, and they'll help guide us in that challenge.
Thank you. The last question is in regards to our student workers. How will they be welcomed back to campus, and will student workers be an option for the fall term?
I'll defer to, I think, Vernon and Melanie, you're probably employing a lot of them. But we are welcoming them back to fall, but I'll defer to Vernon and Melanie to be able to answer that more specifically.
Yeah, we look forward to welcoming back student workers. You know, we will have adjustments to our programming and adjustments to kind of our way of doing the work. So that will certainly have impact in the numbers of student workers that we'll have across campus. But we certainly look forward to welcoming back our student workers, as they are important members of our team.
Absolutely, looking forward to it. So we'll of course have to follow safety protocols and guidance, and so where we can safely have student employees back, we are going to welcome them with open arms. We can't wait.
Thank you. And really, this really is the last question, and it's because it's come up many times as a follow-up, and that is, we answered the question fully, thank you, Provost, around faculty and students not returning to campus after Thanksgiving break, but we did not answer it for staff. So can we get some clarification for that? And I apologize to our attendees who have made that clear. Thank you.
So the change to the calendar is for instruction only. So basically what happens is right before a break, the students will, the instruction will not be on campus. So we will vacate the residence halls. But when it comes to folks that are working on campus, whether it be faculty, staff, or administrators, we'll continue with the low density efforts that we have. And again, some people will be teleworking, some people will be coming in part-time. We're working those out, but those will continue for the rest of the fall semester going into the January period till the students then return at the end of mini-mester.
And President Schatzel, I just want to add, we will have, although a very small number, we will have some students on campus post-Thanksgiving, as we did last semester for students who have particular needs, extended housing needs. And so we will have student present, although minimal in comparison.
Thank you, Dr. Hurt.
Thank you. I think this concludes our time limit today. I'm going to turn it back over to President Schatzel.
Well, I hope this was helpful. There's much change that's going to happen over the next 4 weeks because the efforts of actually doing the work rather than planning the work are now happening. We're planning on the fact that we would do this again in about 4 weeks from now. Hopefully there'll be more people that are coming to campus at that time too. So we'll start opening the campus up in the gradual phasing. So perhaps the questions will change at that point in time. But we look forward to being able to do this again in about a 4-week period of time with more information that will be given. Please go to the Return to TU website to be able to do that. There's frequently asked questions. There's places where you can do that. And once again, I just want to say thank you to everyone, the faculty and staff that are working so hard and collaborating with each other. The sense of unity and the sense of support on the campus has just been fantastic. So again, thank you so much, and please stay safe and please stay positive, and look forward to seeing more of you in the fall.